way home from a 14-year trip, and I was like, tell me everything about Vima. And you could see the look in her eye that was like, oh, I don't know if I'm supposed to do this or not. You know, she was well versed in the business, and she did a great job. But she referred me to Chrissy, and I got going in the sense that I was like, wait a minute, this is a no-brainer. This is vitamins that I support health and wellness, and I can make extra money doing this by helping people get healthy. And wait, there's a student loan repayment portion. Remember that part about being a PA? That's not exactly a cheap degree, although none of them really are these days. So for me, the business side of it was like, that's a no-brainer. Like, I need extra money, and I got the business side. I was the number 3. Or, yeah, number 1.
Number 1.
Oh my God, I was the number 1. And then I kind of backpedaled. I was like, wait a minute, I need to make sure that I actually believe in these products. And the reason why is in medicine, right? I have a degree that says I have the authority to blah, 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 blah. Well, I wanted to be able to recommend these to my patients, essentially. So, sure, pass them off to my friend or my family, but I was like, all right, let's see if this is something that medically I would say, this is a good product that I recommend for you. So what I did is I took a little bit of time, did a bunch of research, and that's kind of what I want to share with you guys today. So, from the first standpoint, for those of you who are new or newer, you really can let the product speak for itself. So the stuff that I'm going to teach you tonight, I hope this will increase your confidence and get some of your questions answered, but there's absolutely nothing wrong with doing what anyone did. Here, try this. Here, try this. That's our number 1 thing. Let the product speak for itself. It's good, and people will tell you that. Well, that stuff's really good. So if you're not really sure about the science and not really sure, you're like, I know it's a liquid vitamin supplement and it tastes good. That's a great place to start. So don't be afraid to just let the product speak for itself. So that's kind of my number 1 point for tonight. Now, the second part, what do you do when they want to know more, right? And you're like, oh gosh, I don't know this stuff. Well, I'm going to look to give you guys a couple of things to be able to say, 4 things or so about why this is actually a really good product. My other goal is, I have a master's in medical science and a physician assistant degree. I don't know that anybody else in the room does. I know that she's got her pediatric trauma, so call us when you have questions. But we want to be reproducible, right? It's not possible for everyone in the room to know everything that I know about science. So that is also my goal, is to help you guys be able to repeat what I'm telling you. So number 1, 2, my numbers are up. Number 2, Vima was developed by a doctor, right? That gives the product credibility right there. So Dr. Yibing Wong, medical degree, MD, and PhD. So he's got a scientific degree and his medical degree. You can tell people that, well, this was developed by a doctor. You know, this isn't just some company that's coming up with something that we don't know what's in it. This was developed by somebody with credentials. So that's number 1. The second thing to really focus on is that what's key about this vitamin is its liquid form. I don't know of many other vitamin supplements out there that are liquid form. The reason why that's key is because that is where this absorption part comes in. So let me ask you something. How many of you have ever taken a pill form vitamin, not Vima, and about 30 minutes after you take it, your pee is like bright green, bright yellow, right? So that is your body getting rid of the vitamins. It's saying, well, I can't absorb this, I can't use this, I'm going to dump it. Now it's a natural part of your body, that's what it's supposed to do, but right, we want to get these vitamins inside of us. So that second key point, it's a liquid formula, and what that liquid formula does is allow for it to be about 90% absorbed as compared to about 20% with pill form. So how do we know that, right? Which leads me to the next one. Vima has done clinical trials to prove that it works. So you can go pick something off the shelf at Target or Vitamin Cottage and say, oh, well, it says that it has all of these things in it. How do you really know that those things are in it, right? Well, they did clinical trials. So the medical side of this is they did the best trial, but they're double-blind, randomized, controlled studies. Now, what you can just say is, it is the best type of medical trial, essentially. But the randomized double control, essentially it gives one group of people who have no idea that they are not getting Vima, and another group of people who have no idea that they are getting Vima. So it takes the bias out of it. There's no way to manipulate the data, because there are other types of clinical studies that there can be some bias, or there can be some data that's collected that's not accurate. So essentially, they did the best type of clinical trials to prove that this is a good vitamin. So that's a key point. This is the best type of clinical trial. That's what you can tell your customers or your friends or your prospective people. Now let's talk about those trials. So they did a bioavailability trial to show that the vitamin stays in your body for 6 hours. That goes back to the other vitamins where you pee them out in about 30 minutes. You know you're not keeping those in your body. So in one of these trials, they were able to prove that the vitamins stay in the body for 6 hours. That's a pretty good amount of time. If you're doing the 2 ounces in the morning and in the evening, as is sometimes recommended for like people who have medical challenges, you're getting most of your coverage all day long. So your body is not only getting what you need and absorbing it at that 90% value, it's staying in the body for enough time for us to actually use it. So best time to trial, bioavailability, so it's available in the body for 6 hours. And then I have already said this, but part of that study was showing that 90% absorption rate. Okay? Next, we talked about mangosteen, right? Oh, it's got the highest level of antioxidants. It's a fruit from Asia, right? A delicious fruit. I hope everybody here has gotten a chance to try Vima, because that's that orangey taste you can't really describe to anybody. What does it taste like? Huh? Creamsicle. Yeah, I have heard that a couple times. So the reason why antioxidant formulas are so big in health and wellness is they reverse oxidation. Now I'm going to get a little scientific on you here, but when you see those commercials about, oh, get your acai berries and your antioxidant levels, we know in science that these things called free radicals damage your cells. When we damage cells on all levels, it causes disease. So inflammation and oxidation are the basis of almost all diseases. We know it can cause cancer, it can cause autoimmune disease, it can cause aging. That's what causes your wrinkles. It's the damage of your skin cells as you're going through life and hopefully having a good time. So those antioxidant properties of the Vima formula are designed specifically to help reverse or prevent further damage by taking that vitamin. Now, mangosteen has been shown to have one of the highest levels of antioxidants in comparison to a lot of other fruits. Now, how did they show that in this clinical trial? Like, how do we know that you're actually reducing inflammation and oxidation? Well, they measure it. There's lab tests that we can draw blood from you that say you have inflammation in your body, and we know that you are suffering, essentially, at the cellular level. So when they did this study, they did comparison, right? That group who didn't get Vima and the group that did get Vima, and they basically showed, and the lab is called CRP, it's C-reactive protein for anybody who's science-minded in the audience here, that the people on Vima had a decrease in that inflammatory marker. And this is a big deal. I worked in preventative cardiology prior to being at the student health clinic, so this is stuff I'm very, very familiar with. So that's the next study. Then they measured immunity, and very objectively, they drew blood in patients before and after going through a Vima trial to show that their immune markers literally jumped up. In addition to that, they also asked people how they felt, right? A little bit more subjective, hard to scientifically measure how you feel, right? Sometimes we feel great, sometimes we feel bad, but they asked those questions. The people in that group generally felt better. They also reported less days being sick, and they reported less days of missed work. That's a big data point that even our nation used, like, oh, the number of days missed of work due to illness causes billions of dollars of loss in work, you know? So Vima essentially was like, let's see how people feel when they're on this. And so not only objectively with their immune markers did we see that people's immune systems were better, people were also subjectively reporting they felt better and they were doing better. So that covers the 4 different trials that they did. I don't know if you guys have really seen this. There's lots of information to learn, but your Vima product sheet has a lot of information on here. And so if you find yourself in a situation where maybe these 6 key points or however many, I gotta work on the number organization of my tops, but you know, say that wasn't quite enough for you and you're like, gosh, I don't know what xanthones are, and I have no idea why the aloe vera is in there. There's a section in here that has frequently asked questions, and you can pull that out for your people and just say, here, go ahead and take this home. Because there are always people in health and wellness that really do want to know what's going in their body, and then there's some of us that just want the energy drink. You know, so know your client and what are they really asking you for. And then last but not least, but like, of course, if you have questions that you just don't seem to be able to find the answer, like this business is all about working as a team, and so connect with us. Like, I'm on Chrissy's team, and you all know that. I'm sure you all know how to get a hold of her. She can help connect you to me. Carolyn is really great with, I'm going to pimp you out there. I hope that's okay. But like any person you know that has like a medical health background, like we're willing to help and we're here to help you. So don't be afraid to ask for help if you didn't quite get what you needed. So